Good day and welcome to the Valder Beebe Show. I've got a great topic to start off with this morning. I've got Dr. Anthony Heaney. He's here with me, and I have Becky Bierman. She's also going to give us some understanding of acromegaly. Dr. Heaney, Becky, welcome to the Valder Beebe Show.
Good morning.
Good morning,
Good morning to you also. Doctor, I have never heard of acromegaly, but I'm not a talk show hostess. I'm not a medical professional, so you're going to enlighten us this morning. What is acromegaly?
Sure. I don't think you're the only one that hasn't come across this rare disease, Valder. Thank you for having us. We're happy to be here partnering with KIC Global Rare Diseases on this important topic. So acromegaly is a rare condition. Only 25,000 people in the United States have acromegaly, and it's caused by a benign tumor in the pituitary gland, which is situated just at the base of the brain, right in the center of our heads. The problem is that this benign tumor produces too much growth hormone, and that growth hormone causes a variety of symptoms, including headache and fatigue. But if not treated, it can cause other more problematic things, such as increased diabetes, increased blood pressure, growth of tissues, causing severe arthritis and other symptoms. And sometimes the effects on the heart can be so severe that it's actually a life-threatening condition. However, the good news is that we have some very effective treatments for all of these issues, which can correct those problems.
Dr. Heaney, is one of the treatments is why not remove the benign tumor?
So we do generally start with removing the tumor surgically. The problem is that we can't always get all of the tumor out. And so about half of folks after the surgery still have elevated growth hormone. And so in that scenario, we typically use a medical therapy. And until recently, one of the most effective medications that we have had to be given as a once-a-month injection, which was very painful and very inconvenient. The good news is that in 2020, the FDA approved an oral version of these medications, oral octreotide or Mycapssa. And this drug can be taken as a twice-daily capsule by mouth and is very effective in controlling acromegaly. And I should say that if you have acromegaly, you really want to talk to your healthcare team and try to figure out what the best treatment for you specifically is, because there are a number of treatment options out there.
Okay, I'm going to go to Becky. I think you know probably more about acromegaly than you probably want to. Can you tell us about your connection with this disease?
Well, I have to say that if you ask me how I felt about living with acromegaly before I was treated and diagnosed, I would say it was awful. I had really bad headaches. There were many nights I would go to bed simply because my head hurt so bad. I also sweated a lot. I had achy joints, and I had these kind of symptoms for over 9 years before I was treated and diagnosed. I was actually at the age of 50. I was at a regular doctor's appointment, and I mentioned to him how I felt like I was just getting old so fast, and that I was frustrated with the amount of money I was spending resizing my rings. And he paused and he said, "What about your shoe size?" And that very short little conversation was enough for him to run the test and find out that I truly had acromegaly.
That's amazing. That is so amazing. How did you feel when you got an answer to "this is what's wrong with me" and now you're getting treatment?
Well, actually, I felt very relieved because I actually felt like, there was something wrong that we could treat and manage. And I was on the injectable, like Dr. Heaney mentioned, for several years, where I had to schedule my life around my treatment, including my work, my family, and vacation times. But I'm now on my Mycapssa for the last 3 years, and I'm very thankful for that med because I'm able to feel like I'm in more control of my life. I just take it first thing in the morning on an empty stomach, and then again in the evening, managing it around my meals and bedtime. And I'm just really thankful that I found a medication like my capsule that I can take and just go on with my life. Now, realize this is my experience. Every person out there is different, but this works well for me. You know, life with acromegaly isn't easy, but I'm very thankful for my faith that has given me comfort and just emotional support to be able to share my story, as I do hope this helps others be encouraged to reach out, ask questions, and advocate for themselves. And thank goodness for Acromegaly Awareness Day that is November 1st. I do hope this encourages others to visit mycapsa.com and learn more.
You're here to share your story, and I'm glad that your faith brought you acromegaly. Belief is a powerful tool, so thank you so much. Dr. Heaney, this is a drug. How do people find out there is an option for their problem? How do they find out, those who have this problem?
Yeah, that's a good question, Valder. And I think if someone wants general information about acromegaly, probably just get on the web, type in the diagnosis, Acromegaly, and get some good information about it. As I mentioned, there are a number of treatment options. We start with surgery, and there are several drugs out there that can be used. So you really want to work with someone who understands the condition, knows the options, and then sort of in partnership with them, figure out what's going to be the best treatment for you. It's not going to be the same treatment for everyone. We're just focusing on one this morning and just trying to raise awareness about this condition, because it is often misdiagnosed for many, many years, leading to a lot of unnecessary suffering for patients with this disease.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.